And joining me now, Cheryl Harrison, the CEO of Muskoka Algonquin Healthcare. Cheryl, thanks very much for joining us. And just jumping into it here, recently in January, the WHO continued the declaration of COVID-19 being a public safety threat globally. And just wanted to look at that on a local level. I know there's been some issues at Muskoka Algonquin Healthcare's hospital sites with COVID outbreaks. And mandates have been put in place to make sure that patients and visitors are staying safe and staying free of COVID spread. But in terms of what the WHO is doing now, I just wanted to check with you, how is that impacting what you do at the hospital? And overall, how are things looking there, in terms of staffing and with patients right now?
Thanks, James. I think that, the World Health Organization has, indicated to us that it's still, an emergency. However, I think we're obviously in a better position than we were at the peak, certainly even at the peak of last year. Our hospitals across the province and including ourselves are very cautious, specifically, knowing the winter season, we're all indoors more and there's other, bugs out there that people can get. So as of January, we've had 6 positive COVID patients across both sites, which has, come down significantly. And we still have staff, that are getting COVID as well, but certainly not to the numbers that we were seeing before. We continue to swab inpatients when they come in on admission. And this is really to keep them safe and other patients safe. Sometimes our patients have to be transferred to other facilities. So making sure that if they do have it, we pick it up early and we can put in the precautions that we need to. We're still wearing masks, social distancing, and doing all the great infection control practices that we know work. So, I think we've come up a little bit in terms of allowing some visitors. So people are allowed to have visitors per two visitors a day, which is great because our patients need that. Certainly they need that interaction with their family. And again, we just really encourage people when they come in. We don't have screeners anymore, but we encourage people to kind of do their self-assessment on themselves. Don't come to the hospital if you're feeling unwell or have any symptoms. The other thing that I think probably puts us on a bit of heightened awareness is that we've heard about this new variant, and it's more transmissible. And our, Ontario Chief Medical Officer as well this past week has talked about everybody being at their highest due diligence. We're not seeing that people are sicker with it, but it's much more transmissible. So we start to see more cases. So that's what's happening at the hospital. Again, everybody's working really hard. We still have health human resource issues around a lot of vacancies, and we're doing our best to try and do recruitment and retention efforts so that we can make sure we have the right staff, right number of staff working.
Well, I appreciate that very detailed breakdown, Cheryl. Just looking to some more positive news now, MAHC once again receiving accreditation, which is a massive thing for any hospital to receive, but MAHC especially getting this once again. Just tell me your thoughts on this.
Our past president and CEO, Natalie Babala, she was the one that really led the charge for the first time we got exemplary, and then it's a continuous cycle. That's what I love to say to people, that it doesn't just stop after a site visit. And so everybody at MAHC should be really, really proud. Meeting exemplary standards is part of our mission statement as well. So it really does ring true. And during a pandemic, when everybody's tired, sometimes it's easy to not always, hit all the high standards and criteria that you want to, but the team that came to visit us was certainly very, very impressed with what we do here.
Mm-hmm. Lots of work being put into it. And, I think it speaks to as well the fact that one of the worst times possible for the hospital to be experiencing with COVID-19, all the upheaval and chaos that comes with that, and still being able to receive accreditation. I mean, that must be a prideful moment as well.
Well, yes, you're absolutely right, because to me, what that says is that we we value quality and safety all the time, no matter what, you know, and it's ingrained in our practice and in our values. We just don't get all ready for them to come, and then, you know, the rest of the time, you know, we don't necessarily meet the standards. It's very, very ingrained in the culture at MAHC.